Genetics of late-onset Alzheimer's disease. The risk of developing the disease. A child who has one parent with the disease has a 50% chance of developing it as well. Treatments discussed above may eventually be proven to reduce the risk of developing the disease. Males and females are affected equally, and can both transmit the disorder with a risk of 50% for each child of inheriting the mutant allele. In the context of medical genetics, an autosomal dominant disorder is caused when a single copy of the mutant allele is present. People of Scandinavian descent are at a slightly higher risk of getting it than others. Most people who develop Alzheimer's disease are 65 years old or more, and the risk increases with age. The symptoms of the disease. People with MCI have mild problems with thinking and memory that do not interfere with daily activities. Procedural memory is the memory of how to carry out actions both physically and mentally, including actions that have become automatic. You may feel unable to cope with the demands of caring for a dependent, difficult relative. People with the disorder may become confused, suspicious, agitated, depressed, fearful, anxious, withdrawn, or angry. As the disease progresses to later stages, patients become immobile, literally forgetting how to move. In the final stages, people may have severe problems with eating, communicating, and controlling their bladder and bowel functions. Findings from gene network analysis and disease genetics. Studies of human genetics in human cells is essential to understanding the etiology of AD. Depending on which histone residue is affected, the same post-translational modification can have different effects. A large sample is especially important to find rare genes that might be involved with a disease. Functional analysis was performed to examine the biological functions of the genes associated with differentially methylated CpGs. Genetic studies play an essential role in identifying the molecular mechanism of disease, particularly in highly heritable diseases such as AD. As sample sizes grow through new collections and collaborative efforts, and as new technologies make it possible to test alternative hypotheses, it is expected that new genes involved in the disease will soon be identified and confirmed. The age of onset and genetic characteristics. Living with a genetic or rare disease can impact the daily lives of patients and families. The clinical features of the affected patients whose clinical records were available are presented in Table 1. Both provide a comfortable, secure place for a senior to reside during the day, enabling them to socialize, stay active, remain productive and enjoy an improved quality of life. Sporadic cases are much more common than familial cases, and usually occur in the later stages of life. The disease actually starts several years before any symptoms are experienced, and the initial symptoms are very mild because the disease progresses so slowly. Dementia affects around 50 million people worldwide, with nearly 10 million new cases each year. Genes and gene products. About 15% of Americans who are not currently caregivers expect to become caregivers in the next 5 years. You might be confused about where you are and how you got there, or forget what time, day, or even season it is. To help you cope with caregiving responsibilities and to manage your stress, it is important that you remember to take care of yourself. At the end of 10 weeks, the caregivers tended to be more engaged with their partners. The final phase of the disease may last from a few months to several years. Prevention takes a very long time to prove, in contrast to amelioration of a disease, which takes a relatively short time. An enrichment strategy in clinical trials. Doctors use a variety of standardized clinical tests to make a probable diagnosis of AD. The diagnosis of AD is a clinical diagnosis, focusing on the exclusion of other causes of senile dementia. When your loved one reaches the point of needing professional help, do not be too proud to ask. The results do not diagnose dementia, but permit the administrator to know if further action is necessary. Many people continue driving for quite a while after the diagnosis, while others stop right away. In many people the effect is modest, and in others, the effect is not noticeable. Your healthcare team. Dementia can cause problems with memory and how well a person is able to think and plan. One of their most useful features is their transparency, making them easily observable in microscopy. Even in familiar settings, a person with Alzheimer's disease may get lost or become confused. Categorized as a chronic neurodegenerative disease, AD usually starts slowly and progressively worsens over time. The risk of developing AD rises after age 65, and rises sharply after age 75. As the disease progresses, patients have more difficulty verbalizing their wants and needs to others. Foundational science to new and novel research. Physical tests are an easy way to determine the severity of the intention tremor and impairment of physical activity. Within the United States, there are at least 5 million people currently living with age-related dementias. Age-related forgetfulness occurs because the brain is aging and changing, just as the body changes. Subcortical dementias occur because of problems in the part of the brain beneath the cortex. When you work with an online counselor, you can directly tell them what your communication needs are and work together to find the best way for you to feel understood. Cortical dementias occur because of problems in the cerebral cortex, the outer layer of the brain. Healthcare institutions. Prescription drug and medical device lawsuits involve a special area of the law known as product liability. Both early life and later life depression have been found to increase the risk of developing dementia. Treatment of multi-infarct dementia focuses on controlling the symptoms and reducing the risk of future strokes. Doctors treat the symptoms of the disease as well as work to slow its progression. Japanese Americans have been reported to have the lowest prevalence of dementia compared with other ethnic groups. You'll want to find long-term strategies to help lessen the severity of symptoms and even prevent them from happening. Brain from normal age-related cognitive decline. A high positive predictive value may not be clinically useful since the diagnosis can be made clinically. One of the major drawbacks to being tested for the APOE4 gene is that the test is considered what is called a susceptibility test because it has limited predictive value. Patients diagnosed before the age of 65 are considered early onset, while patients diagnosed at 65 or older are considered late onset.